Are you over the age of 50? Are you thinking about getting the gastric sleeve or the gastric bypass? Well, in today's video, we're gonna ask the question, am I too old for this surgery? And that adventure starts now. If this is your first time on the channel, do me a favor, hit that subscribe button, ring that bell so you'll be notified of all videos coming out about my journey through this weight loss surgery and your journey through this weight loss surgery. My name is Marina Franco. I am 51 years old and I am scheduled in 3 months for weight loss surgery. And the question that I see in different, Facebook groups and stuff like that is, am I too old for gastric bypass? So of course I Googled oldest bariatric patient, and what came up was an article from AARP. I had to double check that. And that person is Ren Fieldings, 83 years old when she had the surgery. And according to this is 2019, she was 91 years old at that time in 2019. So she kept off 80 pounds. 80 pounds she kept off, and she reduced her diabetic medicine. It says she enjoys a better quality of life. And in fact, there's a quote from her that says, I don't think age is a limiting factor insofar as having surgery. 83 years old. Now, again, I wanted to Google, is there an age limit to the surgery? And again, according to Google, there is no age limit. However, when you get to say 65 and older, then yes, it's a little more riskier. But that got me thinking, isn't everything at that age a little more riskier? Isn't having heart surgery riskier? Hip surgery? Any type of surgery, really, isn't it riskier at that age, especially if you're not in good health? And so why would having bariatric surgery why would your age keep you from having bariatric surgery? Now, I know, even for myself at my age, it is a thought of, am I a little too old? Probably a few years back, I was like, you know what, this is the weight I'm going to be, and I'm just going to sit at this weight. Nothing, I can't go down, I could go up. I have really been kind of staying in this particular weight for a long time now. And it's like, oh, this is where my body wants to be. But the truth is, it doesn't. I can fix that, right? And I know there are going to be some, Marina, diet and exercise. I've tried diet and exercise, and guess what? So even me at my age, had to think, am I too old? And I had to do the pros and cons, the benefits. If I didn't get the surgery, what would happen? I would probably either stay at this weight, have knee problems, or gain more weight throughout the years. Maybe my business would deteriorate because I get tired real easy. I have a hard time sleeping. I'm premenopausal, so, I got the hot flashes going on, and that's a lot of fun. We'll talk about that in another video. It's just, would I get a better quality of life like Ren if I get the surgery done? Or do I just stay where I'm at because it's a little nerve-wracking or it's a little scary having surgery, especially this. You're changing your whole lifestyle for this, right? You have a smaller stomach. You're not going to go out to eat as much. You're not going to go enjoy lunches like you had. You can down the road, but the first year, I know it's a struggle. And so you're changing your relationship with food, right? But what if you are 60, 65, 70, and you're thinking, should I get this? Again, you need to weigh the benefits against the risk. I can't answer that for you, right? I'm not living in your shoes. Only you can. But I will say one thing. You definitely, if you're thinking about having this, you definitely need to talk to people, right? Talk to others in your age group. Talk to doctors. Talk to bariatric doctors. Do research on bariatric doctors that take older patients. See what the success rate is. See what the success rate is, even if you're not in that age bracket, right? What complications could arise from the surgery? What complications could arise if you didn't have the surgery? These are all questions that you need to ask yourself before going in. Now, I don't care what age you are, you need to ask yourself these questions, and you need to ask your surgeon these questions, right? If there's a surgeon that says, no, I won't take you, do you stop right there? I guess it depends on how badly you want it. You know, if you really want it, then you go to the next, and to the next, and to the next. I'm not saying go to some backdoor doctor that will throw you up on a dirty table and, you know, do the surgery, but definitely voice your concerns. Let them voice their concerns, have a conversation about it, and find one that you're comfortable with, that is comfortable doing the surgery at that age that you are, whether it's 65, 70, 75, or heck, in Ren's thing, she was 83. So, you know, there are doctors out there that will do that and will help patients that want the surgery. But make sure they're a good, reputable doctor and, you know, that will take care of you, right? Because if it gives you another 7, 10, 15 years, is it worth it? It might be. I know that's why I'm doing this, because I don't want to be, you know, 60 and my knees have given out and I need knee surgery. Or I'm 60 and now I weigh another 10 pounds from where I am now. And I'm struggling to find clothes. I mean, practically I live in jeans and t-shirts most of the time, okay? And I love looking at dresses and nice suits and stuff like that, but I don't feel comfortable in them. So I don't get them. I don't like the way my legs look, and I don't like the way my legs look in them. I like to wear high heels, but I've noticed that my balance has been a little off since gaining some more weight. And, you know, so am I doing this for those things? A little bit. I'm not going to lie. You know, it's going to be nice to fit into smaller clothes, but I want to not worry about my knees. I don't want to have to go up the stairs and catch my breath. I don't want to have to be walking down the block and catch my breath. I don't want my pre-diabetes to turn into full-blown diabetes. I don't want my cholesterol to go sky high. I don't want to have to worry about getting heart surgery when I'm 65 or 70 years old. So ask the question, get the answers, talk to your physician, talk to your bariatric specialist about your concerns. But in the long run, if it does bring you better quality of life, will it not be worth the risk? That's a question you have to answer. All right, guys, until next time, I'll see you around.